Hi, my name is Jonathan Nguyen, and my presentation is on an article titled The Treatment of Diabetic Gastroparesis with Botulinum Toxin Injection of the Pylorus by Brian E. Lacy et al. So gastroparesis is delayed emptying of the gastric system, and up to 50% of type 1 diabetics show symptoms of it. It is suggested that elevated pyloric pressures could be the issue for the delayed emptying in diabetics. This study looked at the botulinum toxin, or Botox, because it inhibits the release of acetylcholine, producing transient paralysis. This is a comparison of a healthy person and one who displays gastroparesis. Because of the blockade in the pyloric sphincter, right here, the person experiences bloating and feeling full very early on. They identified 8 qualified subjects as well as 8 age and sex matched controls for this open label trial. It spanned a 12-week period, but only 7 of the 8 completed the program. They saw very promising results in decreased gastric emptying times, but not without some side effects such as increased insulin units and weight gain. Here are some of the noted sources that led to this research. They wanted to see if the Botox injections into the pylorus improved the symptoms of gastroparesis better than typical treatments of prokinetic agents. Their working hypothesis was elevated pyloric pressures delay gastric emptying, so transient paralysis of the pylorus should accelerate gastric emptying and improve symptoms of nausea and vomiting. Here is more of a breakdown of the subjects. They were referred specifically because of their insensitivity to prokinetic agents. They were injected with 200 units of botulinum toxin in the pylorus. They measured the subject's symptoms, weight, insulin dosage, gastric emptying, and obtained anthropyloric manometry recordings before and after the injections several times over the 12-week period. This graph shows their symptom scores at before, 1, 4, 6, 8, and 12 weeks. We can see a significant improvement after 1 week of treatment. All 8 patients said the symptoms decreased, with the greatest drop in the first week. The most improved area was nausea and vomiting, and new gastric emptying scans either improved or normalized in half of the subjects. This is significant because of the patient's previous lack of improvement of symptoms with prokinetic agents. Although not all subjects saw an improvement in their gastric emptying times, their other symptoms did improve. This could be due to many reasons like delayed response, but it would call for more research. These manometry readings show the improvements across the board, but the most impressive was the decrease in the phasic activity of the pylorus in the third panel down. In conclusion, the botulinum toxin injections were safe and improved the subject's symptoms, even though there were some adverse effects. They do recommend more research into this type of treatment because of the prevalence of gastroparesis in type 1 diabetics, which range from 27 to about 58%. Some of the issues that have been noted since the study is that there are some better options for patients now. The mechanism of the toxin can cause some unwanted muscle paralysis, so although this treatment is safe, the long-term effects have not yet been determined. Another issue is that the treatment's lack of improvement in the lower esophageal sphincter function, which is right here. Thank you very much.